want to share my gratitude, as I always do, for all the people that have worked, continue to work throughout this weekend as we face this health emergency in the state of North Dakota. And I also want to thank Lindsey Solberg Herbel. And I don't know how you sign your own name, but here from the North Dakota School for the Deaf, but great to have her here as well as part of the team getting communication out to all North Dakotans. On Friday, we announced a legal action called a state of emergency. We also called that a state of calm because we were well positioned and well prepared as a state. That condition remains the same. Also have said that we want to make sure that we're basing our decisions on facts, not on fear. But to make decisions on facts, you have to have data. And one thing that we've uncovered over the weekend as we continue to work through the situation is understand that we really don't have enough data points to make the clearest decisions that we could have regarding the thresholds that we announced on Friday. As you know, and they're still posted on the Department of Health website, we had 3 thresholds, 1, 2, and 3, 1 being the least restrictive in terms of gatherings, based on the number of cases that were reported positive in our state. We also, along with Superintendent Baesler, released guidance on Friday related to schools and school openings and closures based on 4 levels for decision making. We still stand by those in the sense that those are, we felt they're, sound, fact-based, driven by data. But in both cases, the 2 frameworks were based on our ability to have a statistically significant sample of test cases in North Dakota. And as people know, we've had some capacity issues relative to people wanting and seeking tests but not being able to receive them. The good news is the 11 tests that came back as part of this afternoon's batch all were negative, so we're up to 111 tests, only one of those being positive, and that was the individual, the male, 63-year-old male from Ward County who had traveler contact with someone who had confirmed positive. So we're still in a position where people of North Dakota should understand that the risk remains low and that the nature and character of this virus, while there's still much unknown, we still are in a position where we recognize that it creates more of a risk for people that are elderly or have chronic underlying health decisions. So then that leads us to the decision of why would you think about closing schools, and why would other states close schools if there is not health risks to children? The reason has to do with the math of a contagion. We believe that this coronavirus has, for every person that gets it, because of the high infection and the infectious nature of it, that 2 or more people would be infected for every person that might get it. Well, this creates a situation where, again, we've talked about math at some of the past meetings, but there's some math involved in this, because when we sometimes people use the word exponentially, but they're not using it in an actual strict math case. But in this case if we were to have a doubling in the state of North Dakota, it's great that we've got only 1 confirmed case. With the lack of testing, we can presume that we've got more cases in our state than what we are aware of. We don't know how many, but whatever that number might be, let's say instead of 1 case, there's 2 cases. Well, 2 cases, if each of those 2 people infect 2 other people, then suddenly, 2 becomes 4, becomes 8, becomes 16, becomes 32, becomes 64, becomes 128, becomes 256, becomes 512, becomes 1,024. This is what exponential means. And if we have that kind of a rapid increase or spread, then that's where we run into the issue of overwhelming our health community. And one of the primary treatments for coronavirus for someone that might have a severe case or if they had an underlying respiratory disease is they need access to care, including access to ventilators. And one of the things that you say, what's the new information from last Friday, is that we've been working over the weekend to try to really understand how many ventilators we have in the state of North Dakota, how many are available, how many are working, what the clean cycles are to get them back in operation after they've been exposed to the virus, and how many more could we get, but we also know that there's a global worldwide demand, which could be leading to a shortage of ventilators, so there could be supply chain issues. So again, the fact that this is a global pandemic and not a local one, if it was local, then you would say, hey, if we're short, we'll just send them in from other cities. Well, we'll send them in from other countries. But in fact, it's because if there may be a global shortage of the thing you need to help care for people that are elderly, that creates an additional potential crimp on our healthcare system here in North Dakota. And so therefore, we've talked, from a math standpoint about flattening the curve. Instead of having a peak of infections that goes up rapidly and comes down, then how do you delay that and spread that over time? And the way you delay that and spread that over time is with social distancing, is that people have less contact with other people, and therefore it slows the spread. And one of the places where we know that, so then this causes us to examine, as the nation has, whether it's professional sporting events or college sporting events, high school sporting events, large gatherings, for the most part are all being shut down. But then there's the actual living and working that we do with going to school and going to work every day. What are the next steps there? Well, we know that we can't eliminate that completely, but we would say, until we get more data, we should try to take the prudent steps, the conservative steps to try to figure out a way to reduce that. So one of the places where we have over 110,000 students that gather daily is in our K-12 system across the state. We know that this creates a burden for families and for workforce if we were to close those schools, but we're making a recommendation tonight that statewide we close the K-12 schools for 1 week. That is in 5 days. And why would you say 5 days? What's going to be different in 5 days? Well, there's two things that we hope to have that would develop over this week. One is we hope to have better data. Meaning that we hope that there'll be more widespread availability of testing that goes on, so we can have a better understanding of the spread, and that'll help us figure out where we might place on the 3 thresholds that we announced, or where we might be relative to the 4 levels for decision making. The second thing that we know is that, well, many organizations have done disaster planning, and some organizations have even done pandemic planning, including the state of North Dakota. When we're in the situation where we're in a real situation and we've got an understanding of how this is occurring over the globe, we've got an opportunity here to improve and refine and make those plans better and stronger. And those plans, as far as potentially reopening schools, because if you're saying if kids are healthy and kids have little impact from this, could kids be going to school again this spring? They potentially could. But could that include if we had the ability to check kids' temperatures when they're coming into school to make sure that only healthy kids were coming in? Those are the kinds of things that we'd like a week to plan. So in addition to closing the schools for the week, we're asking that all essential personnel from administration and leadership that would be working on those school plans report to work on Monday and Tuesday of this week. If they need more time, they can do that. Of course, they can figure out a way to work from home or do teleconferencing or figure out how they have to do it. But we want to see that all 175 school districts in the state develop plans for when we have better data, then how we would go through a process of reopening our schools. As you know, this has been a rapidly evolving situation, and again, since Friday, the new information that has come through, some of that includes new guidance from the CDC, and their most recent guidance, which just came out this afternoon, was more restrictive, and it talked about large events and mass gathering. These would be weddings, parades, concerts, and events. There's a definition of what a mass gathering or large event is, but they're now recommending that mass gatherings and large events have no more than 50 people. And the reason why they're specifying mass gatherings and large events is because that's where somebody new might come into a community. If you have an existing set of folks that you know, like your own family members or others that you work with regularly that are healthy or they're practicing good hygiene, they're staying home when they're sick, again, the risk remains low, but what we're trying to do is stop the spread of the disease at the pace at which it spreads. It's not possible to prevent it entirely, but we're just trying to slow down the spread. In terms of what local school leaders and the questions that they might have, we're setting up a call for 8:15 p.m. tonight, so half an hour from now. The Superintendent Baesler and I will be holding a dial-in conference with all of the superintendents across the state. I know that they'll have questions, many questions, because there are questions around school nutrition, there's questions around special education that will all need to be addressed in terms of the responsibilities that schools deliver, and we'll look forward to starting those discussions at 8:15 and then moving forward from there. But again, we are by executive order ordering the closing of K-12 schools, both public and non-public, through Friday, March 20th. We will revisit this at the end of the week based on better data and better plans at that point in time to decide where we go next. And so again, you might say to yourself, why are we doing this thing now? Part of it is we're continuing to try to learn from the examples of other countries that have handled it well and other countries that have handled it less well. We're trying to learn from other states where the spread has been much more prevalent than here in North Dakota. And I'd say again, the good news for North Dakota is that we are still in a position where we have an opportunity with being among the least cases reported in the nation, that we've got an opportunity, we've got the people, and we've got the capability, we've got the time to make sure that we can handle this thing and handle it well. If you need more information on this, again, there's a couple places we recommend as your best sources. One is health.nd.gov. The other is the CDC website, which is coronavirus.gov. Those are our two locations to go for more information. Also, at 9 o'clock tonight, we're doing a dial-in call with all of the medical providers across the state, and so we get a chance to talk to them to make sure that in addition to having better plans within our K-12 districts, we've also continued to make sure that we're doing planning statewide. There are, we've got a bunch of great health institutions in our state. Local, regional, in our state. They all have got work that they've done as part of their course of being in business around pandemic planning. But one thing we know is that we need to make sure that we're coordinated so that if we have an outbreak in one part of the state versus another, that we need inter-system collaboration between what might have been perceived as competitors. We need stronger inter-system collaboration than maybe we've had a need for in the past. But we're going to start talking with those organizations tonight about how we do that. In closing, I just want to say that one of the things that I appreciate and love about North Dakotans is they're pragmatic and they're practical, and whether we've got a blizzard that shows up the night before and we got to close school, people figure out a way to manage and get it done. When we've got severe weather events, we always figure out a way to get through that. And I know that our state will come through this thing, and potentially we have an opportunity to come through this even stronger than before. But I would just say again, as we encourage people to seek out facts, not fear, and that's why again, health.nd.gov, cdc.gov or coronavirus.gov. We know we had a 3-hour meeting yesterday morning. And I just want to let citizens know there's a lot of misinformation that is out on social media, on the web, and people should be very, very careful about the information. We've had reports that a very official-looking map design looks like the spread of the coronavirus looks like a Johns Hopkins map was actually placed by a foreign national to try to drive more fear in our country. And so, again, people just have to be really smart about your sources of information and what you're getting. And again, we want to have our state be a shining example of people that are operating on facts, not fear, because when we get into a situation of fear, which it is easy to do in this thing because there is a lot of uncertainty and there's a lot of unknowns around this virus, and so we're in a position that our country has never been in, our state's never been in, so it's natural to have some level of fear, but we want to try to channel that fear back towards curiosity, towards finding answers, towards working together, because if that fear starts driving towards towards panic, then we can exacerbate the situation that we're in right now. So again, as parents, as employers, as leaders, I just strongly encourage people to understand we've got one positive case in the entire state, and I won't list them through, but I could give you 20 other disease classes that have killed more people in North Dakota in the last 3 months, of which we are not talking about at this press conference. But we want to put things in perspective, and we want to continue to work through the situation and gain understanding as we do, and make sure that we're driven by data and driven by solid strategies. And so in doing that, again, the strategy around the school closing is to reduce the rate of infection, to allow us to have a week to plan, not just for how we deliver school services, but for us to plan to make sure that our healthcare system can take care of those that are most vulnerable. The most vulnerable in the state, as I said on Friday, are the people that are elderly or chronic underlying health conditions. It turns out that as a state, we've got a great long-term care system in our state. But with that great long-term care system, we also have a higher percentage of people than any other state who live in long-term care. We have 80 skilled nursing centers. We've got lots of assisted living, and that's the group that we're trying to protect by the school closing. So if we close schools and everybody goes and tries to visit someone with a chronic underlying disease or whatever, that doesn't achieve the objective. If we close the schools and everybody congregates in large gatherings, more than 50 in other places, that doesn't achieve our goals. So in the end of the day, government has a role to provide guidance and recommendations, and in this case, even make decisions, but it all comes back to individual responsibility around social distancing and about your own personal hygiene. That's how we're going to slow the spread. If we slow the spread, then we give capacity, allow the capacity in the healthcare system to care for those, and when we need to, and that's what's going to be the life-saving action. So everybody should understand that their own individual actions that they take has an opportunity to save the life of someone you may not even know if you can help slow the spread of this. So that means if you're not feeling well, stay home. That means practice all the good hygiene. It means cover your cough. It means all the stuff that we've been trying to teach ourselves to do during flu season, but it's more important than ever that we learn how to do that. With that, I want to close and again just say thank you to all the folks that are here, all the folks that are watching, and all the people in K-12 and in our medical facilities around the state that are working to get ready to help us manage through this emergency. And again, thank you for being here, and we'll take a few questions.
What are you guys going to do about the children who depend on school meals? Free lunch, free breakfast?
Kirsten Baesler, State Superintendent, North Dakota Department of Public Instruction. So as I mentioned at the press conference on Friday, the Department of Public Instruction has applied to the U.S. Department of Agriculture for 4 waivers. We've received approval for 2 of those 4 waivers that has allowed us to provide non-congregate meals for our students, which non-congregate means that they don't need to come to our cafeterias, they don't need to come to our schools, we can do brown bag lunches. So we're in the process of mobilizing that. Again, as Governor Burgum mentioned, we are asking our staff, our district staff, to report tomorrow and Tuesday so we can continue to work with our school districts on specifically how we might be able to deliver those breakfasts and lunches to our students and families that need them. I would just add one thing to the governor's comments as a plea to all of us out there and to not only our school districts but every adult that is in North Dakota. It's very important for us to provide reassurance and security to our young people. In times like this, especially with our youngest of our students and our youngest of our children, the uncertainty can cause a great deal of anxiety. The North Dakota Department of Public Instruction is working with the Department of Human Services and Behavioral Health Division to create some guidance and some resources that will be available tomorrow. In the meantime, on our resources page at the Department of Public Instruction, there are links and resources that help adults talk to young children about coronavirus, to talk to young adults about coronavirus. And in times like these, I believe it's very, very important. Routine and continuity is extremely important for young people as they experience challenging times when they are absent the routine of a school, their anxiety may escalate. And so with that, we are asking all of the adults that are caring for a child or in a family's life, or in a child's life, to access those resources. And simply, I think one of the best questions that we can do as adults is to ask children, what have you heard? And so that child can then share what they may have heard. Some may be true, some may not be true, but to have that open line of communication as we move through these very challenging times.
Governor, my grandfather isn't in a long-term healthcare facility, but he is by no means the face of elderly health. Aren't you concerned that the policy of having these kids out of school, kind of going against your policy on Friday, these elderly people, the vulnerable population that isn't in a long-term healthcare facility, can you gauge your concern on that?
Well, I think this is again, social distancing matters, and again, if we've got elderly, if there's a way where we can, whether they can isolate at home, whether they can make sure that the people that they come in contact, if you've got, grandkids or kids that aren't feeling well, they should, keep their distance. I think this is, again, it's spread. We know how this is spread. It's spread through coughing, sneezing, hand contact, surface contact. And so the idea is just to slow the spread by making sure that that contact is separated. But again, this is what I said, if we can close the schools, but if every kid leaves school and goes and visits their grandparents, we won't have achieved our objective of social distancing. The goal is not to close schools. The goal is to improve our social distancing, to slow down the rate of the spread to get off that exponential doubling which other places have seen. Because if it can move at a 1-to-1 instead of 1-to-2, then we can keep the population low, and then our healthcare system may have the ability to help those that actually need access to intensive care, and access to ventilators, access to medical services. We'll have enough beds, we'll have enough ventilators. That's really what we're trying to manage, is that endpoint. We're managing for saving lives among the elderly, and this is one strategy. But closing schools produces a lot of other unintended effects. We understand that. And that goes back again to individual responsibility, where we're asking people to be really thoughtful about their actions, because they may affect people they don't even know.
What kind of data are you looking for today that you weren't looking for on Friday?
Well, I think two things. One is we're trying to get a more comprehensive understanding from the healthcare system of their ability to manage if we end up with a spike, a spike in cases that require intensive care. How can we handle that? We know that some of the health organizations have been working over the weekend, talking about converting floors that were used for other purposes back to intensive care. We know there's been some discussion about recommendations to cancel elective surgeries or other things that might need ventilators. So there's decisions that the healthcare organizations can make and individuals can make that will help free up capacity in the system. We know that we've also got a healthcare worker shortage in North Dakota. We're starting out heading into this thing down about 1,000 nurses, we've got to make sure that we've got all the equipment in place to make sure we're protecting our healthcare workers, because what's happened in other countries, if healthcare workers get infected, then they can no longer report to work, and that compounds this capacity shortage you have. So it's both equipment and personnel, and we've got to make sure that we're trying to protect all those essential workers. The other data you're asking about, of course, is we'd love to have 1,000 tests in North Dakota, not 111. We'd just love to have a better sample to find out where we are, on our thresholds, and where we are on our school closing recommendations. And if we had more data, we could just be marching through that. But we know that one thing about the data. We know that if we get a test that's positive, it's lagging data. And so one of the challenges that anybody that's ever been in information science understands, that if your data is lagging, by the time you make the decision, there may be consequences because you were too late on the decision. So it's under a preponderance of caution, it's under being conservative, and it's under the actual fact that if you were going to say, are there cases in North Dakota we don't know about? The answer to that question is likely, high probability is yes, because of the low testing. So We don't know where the traveler spread, community spread, but if we think there's more, if we believe that based on the lag in data, there's actually more, then this is effectively moving up our threshold levels to the highest level under the assumption that, that there may be more spread than what we realize, and that's why we're taking the action. But if we got the data and the data shows us we're not there, then we can step back down again, reopen schools, or take other precautions about things, including creative ideas about making sure that only healthy school kids and only healthy teachers get into the school, because that represents very low risk. But how do we design for that? Let's give the schools a week, district by district, an opportunity to start doing that planning at a local basis with their best input, with their best ideas based on their situation.
Do you have those tests in place to collect that data over the next week?
In terms of the testing kits, again, working with the private sector, working with our healthcare organizations, working with the federal government. You saw the press conference on Friday, but there are organizations that are here in the state that are working to team up with national labs that have been approved. There are national medical organizations that have released some rapid tests that we've been in discussion with about whether those might be available if there's a capacity. And then there's all the stuff that got announced about the potential for even a much broader, getting all the pharma companies involved. I mean, the Walgreens, the CVSs, the Targets, and the Walmarts, and really getting broad in our country in terms of being able to have access to testing. So that's the federal strategy, but we're going to continue to pursue all of those. We did loosen up on Friday the testing criteria. So again, if there are people that are being turned away for testing, we would want them, if there's, because there have been reports in social media that people have been turned away for testing when they've wanted to get tested. We want those people to call the Department of Health, call the hotline, contact our website, and if people qualify, we want to try to help them get a test, because we want to make sure that the people that need tests are getting tests, and we're working very hard to make sure that happens.
Does it have any effect on daycare facilities?
The order that we made tonight does not apply to daycare facilities. This is an excellent question. There's about 44,000 kids in our state that go to daycare every day. About half of those are in home-based or organizations where they're under 50 people in those locations. Again, we know that this represents low risk to infants and young children, and so some of those organizations tonight may make a decision that they're going to follow the guidance. If the local school is closed, then they close. Others may decide to stay open. Right now, we're leaving that to local decision making as we work through this, but it's another group of people that we're going to be reaching out to this week as we move through and try to gather more information.
Governor, could these closures be extended at some point? Is it fair to say that this is at least 5 days, or is it only 5 days right now?
It's 5 days to be reconsidered at the end of the week based on the data we have at that time.
What
Is there a
about
plan for
mask?
makeup of those days?
The question was, is there a plan for making up those days? Last year, the legislature passed and I signed a bill relative to the educational time requirements in North Dakota, and it switched from days to minutes. And there is a requirement that in the funding model that says that a school day has to be X minutes long. Most of the schools in the state of North Dakota, their school day is at least an hour longer than the minimum. And so relative to where they are at this point in the school year, many of them have banked additional minutes. I'm guessing that the vast majority of them have more than 5 days banked because they'd have more than, that would be, 35 or 40 hours of time more than banked. And so most of them shouldn't require a waiver because under the current law, they don't have to make up days because they've already booked the minutes. But this is one of the things we'll be taking a look at this week, because this is different than it's different than storm days, so we'll certainly be looking at the possibility of waivers going forward. But we also have got a responsibility to educate kids in our state and educate them in a safe, healthy environment. We've also got a responsibility to taxpayers, because the cost of running our school systems every single day is millions and millions of dollars every day to run the school system. So we have to balance all of those things, and we'll look forward to collaborating with superintendents and the teachers and the school boards and across the whole state to figure out what's the best way to serve the educational needs of our students going forward.
What is going to happen with mass gatherings, events, concerts, restaurants? You're seeing it across the country. People are limiting the hours. Is there a recommendation from the state?
We're recommending that from a large events and mass gatherings that people follow the CDC guidelines, which were released today. So again, concerts, parades, weddings, large events, trade shows, they're recommending no more than 50 people at those. In terms of businesses, we're making no recommendations, so businesses can make their own decisions based on the nature of their business, the type of their business, the hours of their business, that the private sector can continue to make those decisions, and as many already have, communicate clearly with their customers and the people that they serve.
Did Minnesota's decision to close schools today have any effect on your decision-making here?
No. Quick answer. But there are, there's, again, we talk about this being a rapidly changing situation. There is, school closures that have been announced in the last few hours across the nation of various forms and types, of different lengths and different approaches. So again, great thing about America is that each of the state gets to be a platform for innovation, and we get to learn about how people are doing it. Minnesota has a lot more cases than we do, and so again, everybody's got their own situations on how they want to approach this. But we're monitoring all the other states, but we're trying to make decisions for North Dakota based on North Dakota data.
This might be a question better suited for Superintendent Baesler. Will this affect standardized testing in any way? I'm not sure when they were scheduled.
Thank you. Again, good question. So the window for North Dakota state assessments opens this week. And so we have been communicating with the U.S. Department of Ed, and the U.S. Department of Ed's position is they will work with states who will then work with school districts on an individual basis. So we have put out information about that on our website. In the case of a long-term closure, we will certainly work with our school districts and our U.S. Department of Ed to meet the state assessment requirements.
Okay, seeing no other questions, again, I want to thank everybody that's here today, and as a message going out to the state of North Dakota, again, part of what makes North Dakota great is the people that we have in our state that know how to respond and persevere through challenges. It's been here since before our state was founded. This is an unusual situation because of the tremendous amount of uncertainty. We know what to do in a flood. We know what to do we know what to do with a blizzard. We know what to do with a drought because we've maybe been through them before. This is new territory for us as we head into trying to deal with the global pandemic and when and how it might reach the state of North Dakota, and what levels and what scale. When it does, it has arrived, at least in a small scale, but when it does arrive, how do we best manage it? So again, I want to just thank everybody for their the support, the prayers, the ideas, the communication, and we do have an opportunity to really come together as in communities and as families. We have an opportunity to come out of this stronger than we did before. And so again, if people are wondering what to do when they're isolating at home, I would say never been a better time to be home isolating. I mean, with the available online resources that are available, take a master class, read a book, start exercising, eat healthier. I mean, this is an opportunity for people to reboot in ways when maybe some of the complexity that we just day to day have been charging through goes out of our lives. And for those people that aren't in the middle of managing this crisis, like some of us up here are, I would just recommend for people to honestly take a look at this and see how this could be a positive for them to get a reset or rebuild relationships, or write a letter to thank that person that you never had time to write and tell them how grateful you are for what the impact they made in your life. But there's an opportunity for us to really take this and turn this into something positive. And as Superintendent Baesler said, as adults, sometimes we think about the impact, the amount of fear that's running around and the new behaviors with the over 100,000 K-12 students and those over close to 45,000 kids in childcare. How we message this to them and making sure that they understand that their risk from this is actually less than the actual flu is important for us to make sure that we're not, creating concern, trauma, and fear in the children of our state, because we have a responsibility to them to message accurately to them as well. And so with that, let's all keep working towards a state of calm. Let's all spend every minute we have to plan smartly. Let's get this spike lowered to make sure that our healthcare providers can take care of our elderly and those most that need. And let's come through this better than any other state in any other country. I know if anybody can, it can be North Dakota. Let's go do it. Thank you.